Diabetic neuropathy, a diabetic's guide to victory. Are you aware that nearly half of the global diabetic population, a staggering 50%, is affected by some form of neuropathy? Given these alarming numbers, understanding diabetic neuropathy and its management is crucial. In this video, we'll dive deep into the various types of neuropathies, explore the intricate connection between diabetes and neuropathy, uncover the symptoms, delve into the diagnostic process, and reveal effective management strategies. Join us as we empower ourselves with cutting-edge knowledge and tackle diabetic neuropathy head-on. Types of neuropathies. Neuropathy is a term used to describe nerve damage, which can manifest in various forms. Let's take a closer look at the different types of neuropathies. Peripheral neuropathy. This type of neuropathy affects the peripheral nerves, which are responsible for transmitting signals between the central nervous system, brain and spinal cord, and the rest of the body. Peripheral neuropathy primarily impacts the extremities, such as hands, feet, and legs, causing sensations like numbness, tingling, and pain. Autonomic neuropathy. Autonomic neuropathy targets the autonomic nervous system, responsible for controlling involuntary bodily functions like heart rate, digestion, and blood pressure. This type of neuropathy can lead to a wide range of symptoms, depending on the specific organ or system involved, such as dizziness, gastrointestinal issues, or difficulty regulating body temperature. Diabetic peripheral neuropathy. This form of neuropathy is nerve damage specifically caused by diabetes. High blood sugar levels can damage nerves throughout the body, but diabetic peripheral neuropathy most commonly affects the nerves in the lower extremities, such as feet and legs. Symptoms may include pain, numbness, or tingling sensations, and this condition can lead to severe complications if left untreated. Other neuropathies include focal neuropathy, which affects a single nerve, usually in the wrist, thigh, or foot, and proximal neuropathy, which targets nerves in the thighs, hips, or buttocks. It's essential to understand the various types of neuropathies in order to identify the specific condition and implement appropriate management strategies. Link between diabetes and neuropathy. The connection between diabetes and neuropathy lies in the consistently high blood sugar levels experienced by people with diabetes. These elevated glucose levels can have detrimental effects on nerves throughout the body, ultimately leading to diabetic neuropathy. When blood sugar levels remain high for extended periods, it can cause damage to the small blood vessels that supply oxygen and nutrients to nerves. This, in turn, impairs the nerve's ability to function correctly, resulting in nerve damage. Moreover, high blood sugar can also directly harm nerve cells, further exacerbating the issue. While diabetic neuropathy can affect various nerves in the body, peripheral nerves are most commonly impacted, leading to diabetic peripheral neuropathy. This condition is characterized by nerve damage in the extremities, such as the feet, legs, and hands, and can cause symptoms like pain, numbness, and tingling. Other factors, such as genetics, inflammation, and lifestyle factors like smoking and alcohol consumption, can also contribute to the development of diabetic neuropathy. Therefore, it is crucial for individuals with diabetes to maintain proper blood sugar control and adopt healthy lifestyle habits to minimize the risk of developing neuropathy and its complications. Symptoms of diabetic neuropathy. The symptoms of diabetic neuropathy can vary widely, depending on the type of neuropathy and which nerves are affected. Some common symptoms include numbness, tingling, or pain in hands, feet, or legs. These sensations are often the first signs of peripheral neuropathy and may worsen over time. They usually begin in the toes and gradually progress up the legs or affect the fingers and hands. Muscle weakness. As nerve damage progresses, muscles may become weak, leading to difficulty in walking or grasping objects. Loss of balance and coordination. Nerve damage can also affect proprioception, the body's ability to sense its position in space, leading to issues with balance and coordination. Digestive issues. Diabetic autonomic neuropathy. Autonomic neuropathy can affect the nerves controlling the digestive system, leading to symptoms such as nausea, vomiting, diarrhea, constipation, and gastroparesis, delayed stomach emptying. Heart rate and blood pressure problems. Diabetic autonomic neuropathy can also impact the nerves controlling the heart and blood vessels, leading to fluctuations in heart rate and blood pressure. This can result in dizziness, lightheadedness, and even fainting. Urinary and sexual dysfunction. Autonomic neuropathy can cause bladder and sexual dysfunction, including difficulty emptying the bladder, incontinence, erectile dysfunction, and reduced vaginal lubrication. Sweating abnormalities. Nerve damage may disrupt the body's ability to regulate temperature and sweating, causing excessive sweating or the inability to sweat. Sensitivity to touch. Some people with diabetic neuropathy may become hypersensitive to touch, experiencing pain or discomfort from even the slightest contact with clothing or bedsheets. It is essential to recognize the signs and symptoms of diabetic neuropathy early, as timely intervention can help prevent further nerve damage and reduce the risk of complications. Diagnosis of diabetic neuropathy. Identifying and diagnosing diabetic neuropathy typically involves a multi-step process, which includes a combination of physical examination, medical history review, and nerve function tests. Early diagnosis is crucial for effective management and prevention of further nerve damage. The following steps are commonly employed in the diagnostic process. Medical history and physical examination. The healthcare provider will take a detailed medical history, including information about the patient's diabetes management, duration of diabetes, and the presence of any other complications or conditions. The physical examination may include assessing the patient's reflexes, muscle strength, and sensitivity to touch, vibration, temperature, and pain. Nerve function tests. A series of tests may be conducted to assess nerve function and determine the extent of nerve damage. These tests can help identify the specific nerves affected and the severity of the neuropathy. Some common nerve function tests include nerve conduction studies. This test measures the speed at which electrical signals travel through the nerves. Electrodes are placed on the skin, and small electrical impulses are sent through the nerves. Slowed nerve conduction may indicate the presence of neuropathy. Electromyography, EMG. This test measures the electrical activity of the muscles at rest and during contraction. Electrodes are inserted into the muscle tissue to record the electrical signals. Abnormal electrical activity may suggest nerve damage. Quantitative sensory testing, QST. QST evaluates the patient's ability to detect various sensory stimuli, such as touch, vibration, and temperature. This test can help determine the extent of sensory nerve damage. Autonomic testing. For patients suspected of having autonomic neuropathy, additional tests may be performed to evaluate the function of the autonomic nervous system. These tests may include heart rate variability, blood pressure response to standing, and tests for gastrointestinal, urinary, or sexual dysfunction. Additional tests. Depending on the patient's symptoms and test results, the healthcare provider may recommend additional tests to rule out other causes of neuropathy or to assess the presence of underlying complications. These tests may include blood tests, imaging studies, such as X-rays, CT scans, or MRIs, and biopsies of nerve or muscle tissue. The information gathered through these diagnostic steps helps healthcare providers develop an appropriate and individualized treatment plan for managing diabetic neuropathy and addressing any underlying conditions or complications. Management of diabetic neuropathy. Controlling blood sugar levels is crucial to preventing or slowing down nerve damage progression. Non-pharmacological and pharmacological strategies can help alleviate symptoms and improve the quality of life. Non-pharmacological management. Implementing non-pharmacological approaches to managing diabetic neuropathy can help alleviate symptoms, improve overall health, and prevent complications. Some effective strategies include regular exercise. Engaging in regular physical activity can help manage blood sugar levels, maintain muscle strength, improve blood flow, and promote nerve function. Peripheral neuropathy exercises, such as walking, swimming, and strength training, can be beneficial. However, it is essential to consult a healthcare professional before starting a new exercise routine, as they can help tailor a program to suit individual needs and abilities. Proper foot care. Good foot hygiene is crucial for preventing foot complications related to diabetic neuropathy. Regular foot inspections for cuts, blisters, and infections, along with proper foot cleansing and moisturizing, can help maintain foot health. Wearing well-fitted, supportive footwear and avoiding walking barefoot can also protect the feet from injury. Balanced diet. Maintaining a healthy, balanced diet is essential for managing blood sugar levels and overall health. Consuming a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats can provide essential nutrients and help prevent further nerve damage. Stress management. Stress can exacerbate diabetic neuropathy symptoms and negatively affect blood sugar control. Incorporating stress reduction techniques, such as meditation, deep breathing exercises, and progressive muscle relaxation, can help manage stress and improve overall well-being. Blood sugar monitoring. Regularly monitoring blood sugar levels and maintaining them within the target range recommended by a healthcare professional can help prevent further nerve damage and slow the progression of diabetic neuropathy. Smoking cessation. Smoking can impair blood flow and exacerbate neuropathy symptoms. Quitting smoking can improve blood circulation, promote nerve health, and reduce the risk of complications related to diabetic neuropathy. Regular checkups. Routine visits to a healthcare professional can help identify any changes in neuropathy symptoms and enable early intervention to prevent complications. Regular checkups can also help monitor blood sugar control and adjust treatment plans as needed. Pharmacological management. Several medications and supplements can be used to manage the symptoms of diabetic neuropathy and improve nerve function. Some of the commonly used pharmacological treatments include alpha-lipoic acid. This powerful antioxidant has been shown to help alleviate neuropathy symptoms and improve nerve function. A study published in Diabetes Care reported significant symptom reduction in diabetic neuropathy patients who used alpha-lipoic acid for 4 years. It is essential to consult a healthcare professional before starting any new supplement regimen. Pain relief. Over-the-counter medications, such as non-steroidal anti-inflammatory drugs, NSAIDs, can help relieve mild to moderate neuropathy pain. For more severe cases, prescription medications, such as opioids or topical anesthetics, may be required. However, these medications should be used with caution and under the supervision of a healthcare professional due to potential side effects and the risk of dependency. Antidepressants. Some antidepressant medications, such as tricyclic antidepressants and selective serotonin-norepinephrine reuptake inhibitors, SNRIs, can help manage neuropathy symptoms, particularly nerve pain. They work by altering the way the brain perceives pain signals from the nerves. Anticonvulsants. Medications initially developed for treating epilepsy, such as gabapentin and pregabalin, have also been found effective in managing nerve pain associated with diabetic neuropathy. These drugs are believed to work by stabilizing nerve cell membranes and reducing the nerve's ability to transmit pain signals. Medications for autonomic neuropathy. In cases of diabetic autonomic neuropathy, specific medications may be prescribed to manage symptoms related to the affected organ system, such as medications for gastroparesis, delayed stomach emptying, or medications to regulate blood pressure and heart rate. Vitamin supplements. In some cases, vitamin deficiencies, particularly vitamin B12, may contribute to the development or exacerbation of diabetic neuropathy. Healthcare professionals may recommend vitamin supplements to address these deficiencies and improve nerve health. It is essential to consult a healthcare professional before starting any pharmacological treatment for diabetic neuropathy, as they can help determine the most appropriate course of action based on individual needs and medical history. Experimental and alternative therapies. In addition to conventional treatments, various experimental and alternative therapies are being investigated or utilized by individuals seeking relief from diabetic neuropathy symptoms. Some of these therapies include neuroplasticity. It refers to the brain's ability to reorganize and adapt its neural connections in response to new experiences, learning, or injury. Researchers are currently exploring the potential of neuroplasticity-based interventions, such as cognitive training or neurofeedback, to help reverse neuropathy symptoms by promoting the regeneration of damaged nerves and improving nerve function. Neuropathy healing frequencies. Sound therapy, also known as frequency therapy or vibroacoustic therapy, involves the use of specific sound frequencies to potentially alleviate neuropathy symptoms. Although not scientifically proven, some individuals with neuropathy have reported experiencing relief from symptoms after using sound therapy. This alternative treatment method typically involves listening to pre-recorded tracks or attending sound therapy sessions, during which various sound frequencies are played with the aim of stimulating the nervous system and promoting healing. Acupuncture. This ancient Chinese medical practice involves the insertion of thin needles into specific points on the body to stimulate the flow of energy or qi. Some studies have suggested that acupuncture may help alleviate neuropathy symptoms by improving blood circulation and promoting the release of endorphins, the body's natural pain relief chemicals. Transcutaneous electrical nerve stimulation, TENS. TENS therapy involves the application of low-voltage electrical current to the skin through electrodes placed near the site of pain. This non-invasive treatment is thought to work by stimulating the release of endorphins and blocking pain signals from reaching the brain. Some studies have shown promising results in using TENS therapy for managing neuropathy pain, although more research is needed to confirm its efficacy. Herbal and natural supplements. Some individuals explore the use of herbal and natural supplements, such as capsaicin cream, evening primrose oil, or cannabis, to manage neuropathy symptoms. While some of these supplements may show promising results in small-scale studies, more extensive research is needed to establish their safety and effectiveness. It is essential to consult a healthcare professional before starting any experimental or alternative therapy for diabetic neuropathy, as they can help determine the most appropriate course of action based on individual needs and medical history. Additionally, some therapies may not be suitable or safe for everyone, and it is crucial to consider potential risks and interactions with other medications or treatments. Diabetic neuropathy can be challenging, but with proper management, its impact on your life can be minimized. By staying informed and proactive, you can take control of your health and better manage diabetic neuropathy. Don't forget to subscribe to our YouTube channel for more informative and engaging videos on various health topics.